Here. Good morning, John. Okay, pursuant to Standing Order 81-4, the committee will now study the main estimates 2018-19 for the fiscal year ending March 31st, 2019, minus the interim estimates the House agreed to on March 22nd, 2018. Number of votes are referred to the committee on Monday, April 16, 28. Vote 1 and 5 under the Department of Veterans Affairs. Vote 1 under the Veterans Review and Appeal Board. I'd like to welcome our Honourable Minister, Seamus O'Regan, Minister of Veterans Affairs, and General Retired Walter Natinchuk, Deputy Minister of Department Affairs. So Veterans Affairs, she'll start discussion by calling on the Minister. Floor is open, and then we'll go to a round of questions.
Thank you, Mr. Chair. And I know we're tight for time, given the House, and so I'll go to Newfoundland speed through my opening comments. I think this is a different department than it was 3 years ago. We are driven by a new vision and a sharp focus on the overall well-being of our brave Canadian Armed Forces members, veterans, and their families. We immediately reopened frontline points of contact closed by the previous government. We started staffing up after years of cuts. We brought benefits into line with where they should have been for years. Year over year, since we came into office, we are committing more money to veterans programs and benefits, ensuring more and better support for veterans and their families. Our overarching purpose is to enhance the well-being of veterans so that they can make a successful transition to life after military service. Our commitment is clear. You can see it in these main estimates. An important consideration is that 90% of our budget, 90% of what you see in the numbers before you, go directly to veterans and their families. The past 3 departmental budgets reflect the efforts we've made to make sure that we treat our veterans with the care, the compassion, and the respect that they have earned. We have used our resources to reopen the 9 Veterans Affairs offices that have been closed, and we opened a new one. We hired more than 460 staff across the country to deal directly with veterans and deliver services where and when they need them. We increased outreach in the North. We opened new operational stress injury clinics to help veterans with service-related disabilities. We increased the amounts of benefits veterans receive. We refocused them to address real-world needs. And we continue to do that. As you'll see, everything in the main estimates goes to improving the well-being of veterans and their families. For example, on April 1st this year, we launched 8 new or enhanced benefits that address education and training, financial security, families, and their well-being. Really, they are all designed to enhance veterans' well-being. The new Caregiver Recognition Benefit provides a monthly payment to people who provide care to veterans with service-related illness or injury, and we have expanded access to the Military Family Resource Centers for veterans' families. These new programs are central to the recognition of the importance of families and caregivers in veterans' quality of life. For veterans, the department will pay for education and training to help them get the careers they want. If they want guidance about what path might be best for them, we're providing career counseling and job resources. Since April 1st, 2018, nearly 400 veterans have been approved for the education and training benefit, and more than 350 CAF members and veterans are already working with career transition services. The new Veterans Emergency Fund provides for immediate financial support to deal with urgent and unforeseen circumstances. 2 weeks ago, I was able to announce that with the Royal Ottawa Healthcare Group, we are setting up the Centre of Excellence in Post-Traumatic Stress Disorder and related mental health conditions. This centre will create and share knowledge on veterans' mental health treatments that work and place it directly into the hands of mental health professionals and others working with veterans on a daily basis right across the country. And last December, I announced that we will fulfill another item in my mandate letter when we restore the Pension for Life option for ill and injured veterans by April 1st of 2019. But I want to tell you about another driver of change at Veterans Affairs Canada. It's about listening to veterans, families, and their advocates. It's about hearing them and taking action on what they tell us. I have held town halls in provinces from coast to coast to hear firsthand the concerns and inputs of veterans and their families, and I will continue to do that through the summer. We have and continue to make changes to respond to those concerns. We are continuing to improve. For years, veterans have been telling the department that it can be difficult to navigate through all these programs and processes. We have improved our approach, and our people are informing and helping veterans access the benefits that they are eligible for. We reach out actively to the veteran community to make sure that they know what they're eligible to receive, and then we help them get it. The effects of this about-face are showing up in the numbers. The main estimates for the coming year show increased demand for treatment benefits. The reason for this is that more veterans are applying for and receiving benefits. That is a good thing. It shows that our increased efforts in communicating and reaching out are starting to have a positive effect. In the coming year, we are enhancing our benefits and programs further, recognizing costs for psychiatric service dogs and the medical expense tax credit will help veterans cope with things like PTSD. We are not forgetting our commitment for keeping alive the memory of the achievements and sacrifices of the men and women who have served our country in times of war, conflict, and peace. This year, we are commemorating the centennial of the end of the First World War and Canada's contributions to the last 100 days that led up to the end of the hostilities. We will also mark the 65th anniversary of the Korean War armistice, and we're investing $24.4 million to eliminate the backlog in repair and maintenance of some 45,000 veterans' graves. We're going to continue to listen to veterans, to hear their concerns, to take action. We're going to hold more summits across the country where veterans and their advocates can tell us their concerns and tell us how they think we're doing. Listening. It seems like such an obvious thing, a simple thing, and yet it is a very powerful thing. And by following through on our promises, we are demonstrating our powerful commitment to those who have served Canada proudly. Veterans today are not the same as the veterans of the 20th century. The needs of the veterans community will continue to evolve. Their needs and the needs of their families and caregivers will also evolve. And this department will continue to evolve to ensure we are meeting their needs, enhancing their well-being, and helping them to successfully reestablish in life after service. Thank you.
Thank you, Minister. And we'll start. I'm going to have to hold everybody tight to time. We are running a little bit behind. We'll start with Ms. Wagenthal, 6 minutes.
Thank you, Mr. Chair, and good to have you here, Minister, and Deputy Minister as well. It would seem that one of your assistants tweeted on April 19th, it would seem that unnecessarily complicating things is what sets standards for psychiatric service dogs back. There was no consensus on a new standard for all service dogs, so instead we're going to work with stakeholders on psychiatric service specific ones, as he put it, so that veterans with PTSD have access as quickly as possible. So, Minister, I'm wondering if you are aware of the extensive research specifically on service dogs that's going on in Saskatchewan at both universities with ODAMIUS, which is a veterans group, which it stands for May We Dare, and really, really high quality testing and research going on, and I am asking if you are planning to include them and their work in determining these standards, because the level of standards here is phenomenal, plus these individuals that are working on this are providing these dogs free of charge to veterans, but they're of the highest quality. Are you aware of them, and are you planning to incorporate them?
I'm not personally aware of them, Ms. Wagenthal, but I, by the sounds of it, yes. I mean, if it's that good as you say, then we'll include the best. The reason we had to
That's fine. That's all I need. I have a lot of questions.
Oh, okay.
I'm
Yeah,
sorry, but I will provide you a bit of a brief and contact information for
please.
them if you'd be willing to have that. I think you would be really impressed.
Yeah.
Great. In regards to the caregiver benefit, on a number of occasions, veterans and their family members have expressed to this committee that the eligibility requirements for the caregiver benefit are too restrictive and that they are effectively excluding veterans suffering with PTSD rather than physical ailments. We've heard that at this committee, and I've also, as we look on Facebook and through the various veterans communities. As some have put it, more money is available, but fewer veterans can access it. What is your response to these concerns? I'm sure you're seeing them as well.
Well, so I got some data ready for that because, yeah, I recognize that that's a concern that's been heard by this committee. 42.5% of people with musculoskeletal issues have received a favorable decision on the CRB. 45% of people with mental health issues have received a favorable decision. And these numbers speak to the fact that veterans with mental health injuries are able to access these resources. So to date, more than 250 individuals have been approved for the new benefit. And as this committee well knows, we're talking about $1,000 a month that's paid directly to the veteran's caregiver, something that many veteran stakeholders had asked for, including some of those who have testified in front of this committee.
Right. Can you also tell me how many that were receiving it up until the new program that are no longer receiving it? They now don't qualify for the funding.
I know that there are some that are in transition. I mean, because it changed from the veteran receiving it themselves to the veteran's caregiver receiving it, there was some paperwork to be done, and as I understand it, 75% of those have made the transition.
That's correct, Minister. And in some cases, we're waiting for the veteran to determine who will be the caregiver, and then that we get the appropriate information, like banking information, so that the benefit goes directly to that caregiver. So we're in a transition in that regard.
I have heard from actual veterans who have that all set out and have been officially denied because they no longer qualify.
Who were getting it before, who aren't getting it now.
Yes. Okay, so some veterans currently have access to rehabilitation services and the earning loss benefit, even if their difficulties in transitioning to civilian life are not related to their military service. As of April 2019, veterans released for medical reasons not related to their service will no longer receive the earning loss benefit, renamed the income replacement benefit. And as of April 2024, veterans released for medical reasons not related to their service will also be ineligible for VACS rehabilitation services. So it means that Veterans Affairs Canada will be having to determine an attribution of service for physical or mental health problems, as well as determining whether any difficulty in the veteran's transition is attributable to military service. So why establish this distinction for rehabilitation programs and the earning loss benefit?
Thanks for the question, ma'am. And the question really focuses on the CISUP program in the Canadian Armed Forces because, again, under the Veterans Act, the minister is responsible for those veterans who have an injury attributable to service. And therefore, as of the 1st of April next year, what we're trying to do, working with the Canadian Armed Forces, closing the seam and convergence to clarify those veterans who have an injury attributable not to service coming under CISUP and those service under the Pension for Life program.
So basically it's cleaning it up. So individuals who are getting those services now will have CISUP as their provider, period.
The CISUP program continues, and that's why we're working very closely with the Canadian Armed Forces on the Closing the Seam effort to actually make that whole transition much smoother with the while folks are in uniform, getting the decisions while they're in uniform, so that there's a clear bifurcation.
Okay.
And I just quickly add to it that I would very much like to appear before this committee the next time and have some tangible results of our collaboration with DND and CAF on how we close the seam.
So as of April 1st, again, medical releasing veterans and their families will have access to military family resource centers, which is a good thing. However, why exclude veterans? I'll just ask the question and maybe you can give it to me later. Why exclude veterans who are not medically released, but we know in time end up with issues, mental health issues and things, and they don't have access?
Okay, and if you could, yeah, you're going to have to get that question back to us,
Yeah.
Mr. Fraser, please.
Thank you very much, Mr. Chair. Minister, thank you for being here today. General, thank you for being here. Always good to see you both. This committee, in its report on barriers to transition, put forward a recommendation to support for spouses and family members on the challenges that they may face through transition. I know that we've heard from many folks across the country that have appeared before this committee, including former General Romeo Dallaire, on the importance of including the family and supporting them through the transition piece. I know the great work that military family resource centers do across the country. In fact, on Friday, I was in my riding at Greenwood, Nova Scotia.
Yeah.
and they were launching the Veterans Family Program and talking about how they were going to do outreach throughout the region in order to make sure people were aware of the services, the good services that MFRCs provide. Can you speak to the investments in the estimates today about expanding programming already going on at the MFRCs and the good work that they're doing?
And thank you for the question. I've traveled and visited several of the MFRCs across the country. I mean, they're doing extremely good work. So as we mentioned earlier, we've expanded access so that you have uninterrupted access to these 32 military family resource centers. And this gets, again, to closing the seam. I mean, one of the things that Walt and I heard, just, tangible things. And I grew up 5 Wing Goose Bay, and the base gym was kind of the center of life. We didn't have an MFRC there at the time, but you had the gym. And the gym is still a huge thing. So suddenly, it's not just the MFRCs, but it's like suddenly, you're released and you can't go to the gym anymore. Which sounds small, but it's where you see your buddies. It's where your wife may go as well, your husband may go, and sometimes they're involved with daycare, children's activities, that sort of thing. So it's just getting rid of that abrupt end, which is causes so much anxiety and can lead to a lot of other problems when it comes to transition. So the expansion of services at the MFRCs is a $147 million commitment over 6 years. In addition, I should add, we're putting $22.4 million over 3 years to better inform people of the services that are there. So I mean, some of that's paid advertising. Some of that is we'll get it out there through social media and just general access points. I was watching. So we've just come from. We're in the middle today. It's unfortunate that both of these events coincide, but that's how it happens. But today we've got a full day homeless summit just at the Delta down the street. And we heard testimony by video from one veteran who said that, I didn't know that the supports were always there. They just seemed hidden. I'm not saying that all the answers are already there. It's just that, a lot of things, unfortunately, people don't know about. So, that is a small portion of it, is making sure that people are aware that these things are available. Although MFRCs, I expect, through word of mouth very quickly in bases and surrounding communities, word will get out about that.
Yeah, I agree with that, and proactively informing veterans and their families about the services and supports that are there is important. The MFRCs do a good job, but the outreach that they're going to be able to do through the Veterans Family Program will be helpful. And you touched on the fact that you're hosting a roundtable, or Veterans Affairs is hosting a roundtable today on veterans homelessness. Yeah. And I know that organizations from right across Canada are here today to speak to that issue. In the main estimates, we see $1 million dedicated to the Veterans Emergency Fund. Mm-hmm. I'm wondering if you can speak to how this and other programming made available will assist homeless veterans in crisis.
So the roundtable, you've got some 70 organizations from across the country, some big, some small, some national in scope or ambition, others extremely local. I think I was only there an hour and a half, yeah. And then we had votes. But I would say, we are not there to talk. We're there to listen. But actually, I think the most exciting part of it is when they talk to one another. So we're already seeing that dynamic around the various tables in the room. So the one, let me run through some of this for you. We have committed $4 million to the Veterans Emergency Fund. And I think I mentioned this to this committee before, that one of the, very oddly, humbling experiences in my first brief with the deputy on my first day was that the department, despite its vast budget, as the members of this committee are well aware, doesn't have the flexibility to actually help an individual when we find out that somebody's homeless. I mean, I think, members of the committee can take comfort in the fact that every single dollar seems to be earmarked. And that's good from a taxpayer's point of view. I'm happy to see that. But we didn't have the flexibility. So we were relying on wills bequeathing funds, and usually those came with, so people will money for homeless veterans. But it's often under various conditions, and it's often geographically specific. People want to help people in downtown Winnipeg, or people want to help people in Victoria. So, one of the deputy's jobs was just to figure out which trust fund or will bequeathment he could find to help a veteran get off the street, which, you think that's ridiculous. So now we've got that flexibility. And certainly, in a 24/7 news cycle, as soon as the news reports that a veteran's been identified as homeless, everybody around this committee, any Canadian would say, we want to get him off the streets right now. Well, at least now we have the ability to act immediately. And we can, if they self-identify, well, we can worry about, where they served or whether they actually, whatever. Like, we can worry about that later. We can just get them off the streets immediately, which I think is really important. And back to the Homelessness Summit, generally speaking, our colleague Adam Vaughan, parliamentary secretary, spoke on this as well. I mean, this is getting people out of their silos so that we can really talk effectively about how we deal with this issue to eliminate it.
Thank you, Minister. Mr. Johns, 6 minutes.
Thank you. Thank you, Minister, for being here. Deputy Minister. The Veterans Affairs Canada website detailed the department's risk response strategy, and as part of maintaining core services, the department admits, quote, Veterans Affairs Canada may have difficulty providing timely, high-quality core services and benefits to veterans and their families, while simultaneously implementing several new initiatives and programs from multiple federal budgets. And I want to underscore core services and benefits. Minister, I know veterans appreciate that your government is trying to address the backlog of applications. However, I've heard from many veterans that they are unaware of the benefits that they're allowed to receive. You touched on that recently. Similar to the $42.8 million you've given to address the backlog over 2 years. I want to know your plan, and veterans want to know your plan, how many resources you need to make sure that veterans know about their benefits, but also what it's going to take to reduce that backlog to zero. We still haven't got an analysis of how you came up with the $42.8 million and what is it going to take?
Well, as I alluded, I spoke specifically to the $22 million that we're on communications to veterans and their families, to caregivers, to make sure that they're aware of the services that are available to them. I'm also keenly aware of the fact that this department, and in terms of the benefits and services that it provides, is going through an immense transition at the moment. Mm-hmm. And as I've said to veterans in various town halls, one of my key goals, and it's a personal goal of mine, is to, much of what we do, whether it be pension for life or access to MFRCs or, easing transition and closing the seam, is alleviating anxiety. Because anxiety can be a trigger for all sorts of things.
Sure.
And anxiety with wait times as well.
Sure.
And all these sorts of things. And the irony is, with all these changes, new benefits and services, we're actually increasing anxiety. And I'm hoping that's a temporary effect. But it's just a lot of change to happen at once.
I think my concern is that we're not resourcing what we need to just to deal with core services. You're making a lot of promises to bring in new programs and whatnot. We still haven't addressed the core needs of the services and benefits that veterans need. I mean, we saw huge cuts under the Conservatives in 2012. We're far from that number in terms of full-time staff at Veterans Affairs Canada to deliver services that veterans need. And I know you've committed this money, this $42.8 million. Is it for temporary jobs, or is it for permanent jobs that are going to be in the department? Because veterans are concerned that we're going to be here again in 2 years. They want to know that there's long-term resources going to be applied to the department to serve veterans.
Yeah.
And sir, thanks so much for the question. I think what's terrific is the fact that veterans are getting over the stigma and coming forward and asking for help. And so to see, upwards of 20 to 30% more veterans coming forward and presenting is terrific. And so we're in a catch-up game, trying to catch up, and that's where the backlog is coming from. And so we're going through the process now of legislation, Treasury Board submission, getting the approval, and then the recruit, train, and deploy. And we're doing a lot of concurrent activity right now. So we're anticipating the approvals through legislation. We're anticipating, the Treasury Board approvals, because without the approval, I can't spend the money. Okay. At the same time, we're creating the pools of those candidates who are coast to coast.
That's a political decision, the government committing long-term resources so that funding's in place, right?
Right. So we're looking for the right Canadians to be able to bring into the front offices. I was just in Brandon, Shiloh last week, and again, looking for folks to be able to serve in Brandon and on Bay Shiloh with the right skills. But I would also say to you, the other thing that we've learned just over the past 2 years is through the digital means, using my VAC account, the fact that we were able to deploy the education and training benefit and the career transition service in a digital way, so that we're actually able to encourage folks to use the digital means so that their application and their approvals are much faster. As the minister indicated, we already have over 400 veterans who are now in the process of getting the grant for education and training, and now over 300 veterans into the career transition. So just to say, the long-term plan is that balance of face-to-face with great employees but also digital where folks can work
I
digitally.
appreciate the innovation and the efforts made to be innovative. I think that when you talk about catch-up, you identified that because more veterans are coming forward, but also you're playing catch-up because there was huge cuts to the department in 2012. I mean, those cuts are going to create a backlog. And what we're hearing is that the department's not adequately resourced to deal with the backlog from 2012. When you have cuts like that, of course you're going to be cutting in service levels. And we saw that with the ratio. The government made a promise to get to 25-1. You're not there yet. What is it going to take to get to those ratios, to get the backlog to zero? We're still not getting those answers. That's what I'm saying. And I just, again, looking at the website that you've been told by the department that they're going to have difficulty providing core services. So I'd like to see the department come back with what you need to make sure you're delivering the mandate. Now, my next question is around the lack of post-traumatic stress injury treatment. We know that the significant contributing factor to some recent deaths by suicide of our veterans is been the need for PTSD centers. We heard from veterans loud and clear that they wanted residential care. We appreciate the new funding that's going into research. Everybody does, and I want to commend the government for that. But we still haven't heard any news about a residential care facility. And my understanding, there was at least 2 that were committed from the government, but the need is probably greater. We're hearing 4, some regional centers, certainly maybe some that could be culturally appropriate for Indigenous people. Is the government moving forward with a commitment to create a residential care facility for people suffering from PTSD?
Okay, 2 things. I just want to bring up a very important point based on your earlier question, and that is an important secondary one to the education benefit has been digital outreach. So we've been able to plow through this a lot sooner. So when you say that we're not exactly sure, we can't tell you exactly how we're going to carry that backlog and make sure that it's sustainable, we're still actually waiting to see how big the uptick is on electronic delivery, and so far it's been tremendous. So that's an important variable that we haven't had to deal with before. Back to
Minister,
PTSD, because I will get to the question.
The question now.
I'm
sorry.
I think we've got to get beyond the idea of residential care, but I can.
If you could get back to us on that question.
Yeah.
We're done. Thank you.
I actually had asked it a minute ago.
He will get back to you.
It's just a yes or no. Are you going to
Inevitably, we will get to PTSD again, I'm sure. But on residential, we can talk about that later.
Ms. Lampropoulos.
Thanks for being with us today, Minister, to answer our questions on the estimates. Currently, we're doing a study on Indigenous veterans, and we know that much of the homeless population in Canada consists of veterans, and that many of them, especially in Montreal, where I live, are actually Indigenous as well. And right now, today, we have a roundtable. I know that we already mentioned this, but I'd like to know if we're including communities from all across the board, and what we're expecting from this roundtable today.
We are indeed. There's representation from across the country, and as I said, some 70 organizations. I think the important thing, and this will, I think, come out as everybody's talking to one another, and I'm anxious to get back there and spend as much time as I can there today, is again, the solutions that each one have found unique to their circumstances. So, we can talk about Indigenous, and there are particularities of Indigenous care that are common across the country, but they're also very specific, whether it be the North and what parts of the North, whether, it would be Winnipeg versus Saskatoon versus Halifax, and that's why drawing upon local expertise is especially important. There are commonalities that I think people will reach, and things that they can learn from one another, and then I think there are some things that are extremely specific. And we don't have all the answers on that, but what we can do is help support those who do. And that's why, the Family and Wellbeing Fund, I think, is very important. I'm not keen on the name. I've never have been, because it's a bit innocuous, but really what it is, it's an innovation fund. So that when you have great ideas that appear, whether it be in any particular city or town or whatever, Indigenous or likewise, and it seems to be working, that we can put money towards it to see whether or not it could work on a larger scale, to see if it's something that, could work perhaps across the country or in similar communities. That gives us a tremendous advantage.
Can I also add, and I appreciate the work that you're doing with regard to studying Aboriginal veterans issues, especially as many of our veterans, after extraordinary service in the Canadian Armed Forces, return to their communities, often remote communities, and therefore the difficulty of providing them a full suite of support is always a real challenge. And the fact that thousands have served in both world wars and peacekeeping missions and ongoing missions today, and so their problems are really unique. What is terrific is we have the Aboriginal Veterans Association, who is represented at the summit today, and Aboriginal veterans are represented on all of the ministers' advisory committees and substantially on the in the summits, whether they be regional summits or the national summit. So their voice is very loud and clear in all of the the outreach that we are doing with different veterans communities. With regard to service in the communities, I think having, again, not only our offices fully staffed, but then being able to use electronic means, whether that be between the Veterans Affairs and the veterans, or in fact between mental health practitioners. We're again encouraging the health authorities across the country with whom we partner for the treatment of mental health. Again, we have 4,000 practitioners, mental health practitioners coast to coast with whom or who deal with veterans on a daily basis. But also from the operational stress injury clinics that we have, 10 of them, including one residential at St. Anne's Hospital, leveraging telemedicine and telehealth, so that whether the veteran be in a remote community, say in northern Manitoba, or whether that veteran be on CFB Shiloh, we can connect the psychiatrist, psychologist, mental health nurse with that serving member or the veteran, no matter where they are across the country. And we've got to get better at that and up our game, because no matter where these folks are, we need to provide them a standard level of service.
Thank you very much. That's really great to hear. It's obviously very important to make sure that all veterans have equal access to service, and this is one of the main issues. So hopefully we can come up with some good solutions today. I'd like also to know, I know that $6.5 million has been set aside for the caregiver recognition benefit, and another $4.9 million for education and training, and there are many other benefits that are included in the estimates. I'd just like to know how we intend, is there a specific plan on how we're intending on getting this out to the public, getting this out to make sure that every veteran and their families benefits from this program?
First thing we've done, I think, is attempt to change the culture of our frontline staff, which is something that we talked about. I think, I went to Charlottetown, I think, on day 2, and spoke to them and said, and I think I might have mentioned this to the committee my last time I appeared here, but I think, it's important to reiterate that we want them to be proactive. So, don't hide the benefit of service, because, we're looking out for the bottom line, although, obviously you want to keep an eye on that. But it's really important. We put the benefits and services in place to make sure people can avail of them, right? So letting our frontline staff know, okay, ask the questions you need to ask to make sure that the veteran or caregiver or their family member is availing of everything that we're working hard to fund for them. So hopefully, that culture change, it's not hopefully, that culture change is taking effect, because word has gotten out. There are days as minister of this department, I can tell you that Facebook and Twitter are the bane of my existence. But it can be very effective on the flip side, in getting the word out. And the word has gotten out that, A, these new benefits and services are available, and B, we will work hard to make sure you get them.
Thank you, Mr. Yolfson, 6 minutes.
Great. Thank you, Mr. Chair. Welcome back, Minister and Deputy Minister. I'm assuming we're all over our jet lag from Korea. I was honored to be on that trip with you and Mr. Johns and Mr. McColman. It was a great experience. Now, in our study on barriers to transition, something that we identified that, although it is a policy in Canadian Armed Forces, it's something that has such a direct effect on veterans, and you being, of course, the Associate Minister of Defense, I thought this was germane, that we talked about the concept of universality of service, and how that seemed to be having a great deal of negative effect on a lot of veterans who, might have been able to serve in some capacity, if not in a 100% deployable capacity. So our recommendation was to, in our report on transition, was that CAF apply a measure of flexibility to the concept of universality of service for selected members. And from the defense, we received a reply that they were going to review this and compare it with compare jurisdictions where they have something like this, like the United States, Australia, and New Zealand. So, have you been able to take any steps on this so far? Have you been able to review this or have any updates from your point of view on this?
I'll speak briefly to it, and I'll have the deputy speak to it. I've spoken with the Chief of Defense Staff, and I think it's fair to say that he understands the importance. Universality of service is something that's kind of core to the military, and a former Chief of Defense Staff would probably be better to speak to that than me. But seeing if we can attempt some flexibility here is something that I think General Vance is looking at. Because ultimately, what that can provide us is putting the best people in the best places. So if we have somebody that's unable to physically serve or has a particular mental capacity in which they can do some things but they can't do others, is there room within the Canadian Armed Forces for them to do some things but not others? Is that possible? That is something that we're I'd say deep diving into, and he's open to it. Would that be fair to say?
Sir, thanks for the question. And again, I don't want to go into outside of my lane, having worn the uniform before. It's General Vance's lane, but I would say that what he's coming to grips with is the fact that for some illnesses and injuries, and again, with your medical background, the access to medical care, if you're on a deployment, becomes a bit of a challenge.
Yeah.
And so perhaps someone with an ailment could not be deployed, say, to a place on the other side of the world, but could fulfill many functions here at home. So that's what I think the Canadian Armed Forces is coming to grips with. You have folks who are extremely talented. In fact, there's been millions of dollars of investment into the skills, the talents, and these folks have proven leadership skills, proven dedication, and yet for whatever ailment, we cannot put them into a austere environment, say in Africa or South Asia, and not have physician or a complete medical practice around them, and yet fulfill extraordinary roles for us here in the country. And I think that's what he's dealing with now, sir.
Yeah.
Okay, thank you very much. Now to change gears, we've been hearing a lot about challenges that veterans face with service delivery in rural and remote areas. And frequently, a lot of that is due to lack of physicians in a lot of these areas. And it's not something that is unique to veterans. I mean, certainly it's hard to find a family doctor for anyone who lives in a small town in, say, northern Manitoba or Saskatchewan. And then even harder to find physicians that would be trained to deal with some of the unique aspects of veterans like PTSD and that sort of thing. So could you speak to the investments from the estimates to address this?
I think, this is something, and Walt just whispered in my ear, this is something that we heard particularly acutely in Belleville and in Kingston area. Although I think it applies to anywhere across the country. It just happens that they seem to be particularly vocal there. It is a part of a larger issue, access to regular physicians. And frankly, not just in remote and rural areas, but, I know friends of mine who lived in Toronto for 10 plus years and didn't have a regular family doctor, but continue to rely on walk-in clinics. It's increasingly difficult to find a GP in this country. What I won't abide by, and what we're attempting to rectify, is our veterans who are discriminated against by doctors because they don't have to fill out 40 pages of paperwork, right? I mean, so if veterans are having even harder a time, even a more difficult time than most Canadians in finding a regular family physician, we got a problem. So we're attempting to see, how can we streamline that? How can we make things easier? It gets into the broader transition piece as well. So I mean, if somebody had a regular family doctor or a regular doctor while they were in the military, how can we make that transition a little easier once they leave? Right now it's like not only not only getting a different doctor, it's finding a different doctor, and then it's file transfer, and my gosh, I mean, you know, it's a lot to pile on. So where can we ease that? I think that's one of
Thank you,
that's,
Minister.
that's top of the list.
Thank you, Minister. Mr. Bizarre, 6 minutes.
Thanks for being here. Time is short, so I'm going to ask some very pointed questions and would like some pointed answers to the Veterans Emergency Fund. What's the utilization rate on that to date?
Oh, geez, look at that somewhere. Do you want to?
Sir, I don't have that detail
you
with
table that
me,
for-
but our officials who are appearing
Yeah.
right afterwards will have that information.
We'll get it.
So the second thing I'd like to ask, in the 2015 platform, Justin Trudeau promised that veterans would never have to fight their government in court for the benefits and the compensation that they've earned. Yet, the order paper question 1502 that was tabled shows that from January 2016 to January 31st, 2018, $37 million was spent on veterans' lawsuits. Can you confirm since 2015 whether the Department of Veterans Affairs has taken veterans to court?
Is it veterans lawsuits or is it generally? Because I mean, a lot of that money, as I understand it, goes to veterans representation for the Veterans Review Appeal Board.
$37 million has been spent according to the order
Yeah,
paper
and part of
question.
that,
So
and
my
a large
question-
part,
my
a large
question
part of that is VRABs. And just to
So-
remind members of the committee that we're the only jurisdiction that I'm aware of in the country where we pay for veterans to fight their government on appeals for benefits.
So the question is, since 2015, has the Department of Veterans Affairs taken veterans to court? That's my question.
No, well, we've represented ourselves.
But have you taken veterans
We
to court?
we as I don't think I need to
Representing
remind the
veterans and
honourable
taking them
member,
to court is two different
we
things.
inherited a few things. We continue to have to represent ourselves in court, and certainly, you know, if there are veterans or veterans organizations who want to take us to court, then, you know, they will, and I can't do anything about that other than making sure that the Government of Canada and this department's represented.
Okay, so what I'd like, Mr. Chair, is for the minister and department staff to table information about lawsuits with respect to veterans, both from the government side, government taking veterans to court, as well as the utilization of VRAB. So I would like that to be tabled for the committee if possible. Second question I have is with respect to the measures announced in Budget 2018. The budget documents indicate that the ongoing cost of the pension for life will be $112 million. That's in the budget plan, page 216, note 1. What is meant by the ongoing cost of the pension for life proposal? What do you mean by that?
Sir, again, the detail can be provided by the officials right after me, but what we're doing is, with this pension for life, kind of like what we've done for the education and training benefit and the career transition benefit, leveraging both the face-to-face contact with the digital. So we're actually creating an online capability so that we can move forward with digital applications, much faster service for folks, but then with additional adjudicators, because we have to do the calculation for the approximately 72,000 veterans who are clients since 1 April of 2006. So it's those calculations, some of which can be done in an automated way, some because of the complexity, and there might be a number of different applications, we actually have to do in an analog way, plus all the digital application processes.
Which gets back to retroactive, making sure that people who already receive lump sums receive the same amount if they apply for pension for life now.
But according to the budget documents, if I'm to read this correctly, it means that the department is calculating an additional cost of $112 million a year for those monthly pensions. Is that the way I read it, or is it something different to that?
But also it's an increase in the amount of money going out the door as well, because it's an increase in terms of the amount of money going to veterans, especially those with serious injuries and those who are injured earlier in their careers.
The calculations that I've seen with respect to the pre-veterans charter, if we were to return to that and live up to what the Prime Minister promised in the last election, could be anywhere from $30 to $35 billion. That's the calculation. Those are the calculations that I see. So something doesn't reconcile here. It's either that you've rehashed a lot of the existing programs into this pension for life option that you speak about, or you've returned to the previous pension. Which is it?
Well, first of all, I mean, let me be very clear about what the Prime Minister has said, that we would go back to a monthly pension, and we are back to a monthly pension, and that will be, I think, quite generous, and certainly more generous and for life and tax-free So that's what we intended, and that's what we will deliver
So
upon.
based on the budget document, Minister, you're suggesting that it's only going to cost $112 million a year?
No, I will make sure that our officials get back to you with the exact numbers, but I will say that I'm pleased with the fact that we are fulfilling our campaign promise.
Last question I have is with respect to the $7 billion slush fund in the Treasury Board. It speaks of $21 million for better services for veterans, $43 million over 2 years. None of that money exists in the current departmental plans. Why is that?
Sir, we can't we cannot put those amounts in until they're approved. So any of the Pension for Life funds, we can't put them in the plans until they're actually through legislation and we have the Treasury Board submissions through it. And then we actually put them in following those approvals.
Robert, do you have something?
Thank you. Minister, this government has talked about setting up 3 centers of excellence across this country. You made a big announcement of one, and putting $17.5 million towards it here in Ottawa, which is a research. Now, we've heard from our veterans throughout, and you've heard from our veterans throughout, that they want facility where it's inpatient, where these people with PTSD are being addressed. This is an academic institution that you've created with this 17.5, which, by the way, only talks about 500,000 in the estimates. So you've made that choice to go, and you said earlier here today that you believe that we need to get away from inpatient facilities.
Very, very deliberate choice.
So you said that.
Very deliberate.
You said that you want to get away with it. The veterans say they want it. You're saying not. At what point in time have you conveyed and communicated that message to the veterans who voted for you based on the fact that you had said that there would be 3 centers of excellence, that they would be getting treatment for PTSD?
Mr. Kitchen, I've repeated it in every chance I can get, and I'll tell you why. Because if I'm living in Kingston, I want an in-house facility in Kingston. If I'm living in Tofino, I want an in-house facility in
we've got to move
Tofino.
away from it.
What I want is I want a center of
conflict.
excellence that will address the country's needs.
So you're
and that
going to put
people
a
from
center of
across the
excellence that
country.
creates academics.
No,
but does
I've
not
got a
provide
center of
that
excellence
service
that
for
will
veterans.
provide research
Mr.
and
Kitchen,
development
can you
that will
let
be
the minister
applicable
answer,
to everybody across the country. Because I can tell you, as somebody who grew up in a remote military community, that an in-house facility in Kingston or Ottawa or Vancouver or wherever does not affect me. And if I have got a certain amount of dollars that I'm going to use, I'm going to make sure that it has outreach to every single community and every Canadian veteran that I can hit with maximum impact.
Thank you, Minister. We're out of time, Mr.
Rural
Kitchen.
community, and I live in a
Mr.
rural
Kitchen,
community,
order,
and these people
please.
do not
Mr.
have these
Kitchen.
services, and they're asking for
Mr.
it.
Kitchen, you're out of time. Mr. Bertina.
I'd like to know something about keeping track of the vets. In our recent tour, we were in Beauval, Saskatchewan, and the minister will know I encountered a 98-year-old veteran of Sicily, Italy, who had walked over 100 miles to enlist back in 1939. And I wonder, Mr., is there a data bank where you can punch up the name of Louis Roy and determine that he's still alive? Because I've been looking up the stats on the older veterans, and the latest one I have is it was StatsCan 2017 that there were about 50,000 Second World War veterans still alive. So you'd probably figure it's in 40-something now. But these are very elderly individuals who may be getting into a very serious care need for themselves. And do we know who they are and where they are, and how do we identify them? In other words, how do we keep track of those folks?
I will let the deputy get into the specifics of it, but I will say this will be one of the great secondary benefits of Pension for Life, is that we will have constant contact with veterans now. What would happen sometimes with the lump sum was that you'd lose touch. And I think actually this is going to have a significant impact on the homelessness situation as well. Because in order to get the money to you, we have to have constant contact with you, which is important for a number of reasons. First and foremost, so that, as people's medical conditions or financial conditions change, we have some idea of what's going on with them. So that's very important. It's also, from their point of view, it's the constant recognition of their service. There's something to be said for getting something in the mail or even seeing a certain amount deposited in your bank account every month electronically. It's just a constant reminder that you are valued and you are recognized. That's something that spills over into the caregiver recognition benefit as well.
Can I just add and say exactly with regard to the pension for life? Now we will have that monthly connection between the department and those new veteran charter veterans. For those under the old Pension Act prior to 1 April 2006, we would know about your 98-year-old veteran if he's actually a client of Veterans Affairs and he came to us. But often for some of these generations of veterans, you can imagine their independence and they don't want help from anybody. And we had an incident here in the city. You might have heard of the 100-year-old veteran where there was a break and enter into his home. And this fellow had been a lieutenant colonel, landed at D-Day, had been the deputy minister of 6 departments. And after this attempted murder on him, we rolled in and said, "Can we help you?" And he said, "Back off. I'm fine." This guy had been a former deputy minister of Veterans Affairs. He said, "I'm not a client. I'm good." And so we need to reach out for when these veterans want to come to us. When we opened the office in Prince George, British Columbia, I was at the opening of that office last spring, and there were 3 door crashers there. One veteran is a 94-year-old Royal Canadian Air Force World War II veteran. And he was at the front door and he said, "I don't need any help at all." But he said, "I'm living 200 kilometers north of here on a 250-acre piece of property. I have no electricity, no water, and someday they're going to take my driver's license away from me, and I just want to make sure you're here." Wow. So just to say is, for some of these folks, it's a question of when they want to present. And for some of them who are coming forward for the first time, even though the World War II, Korea War vets are coming forward for the first time, especially for a mental health injury, as we deal with stigma, we will now know where they are. Or they come to us just before they need long-term care, and again, the door is open to them coast to coast.
Was I going to share with Mr. Sampson?
Mr. Sampson, 2 minutes.
Thank you, Minister, for being here today in general. We don't have much time, of course. They left me last here, so I'm tailing on what's left, so I'll have to hit questions and you can maybe supply me some answers. But Center of Excellence is a big piece of what I think is important. And the structure of it now, I'd like to see how, maybe I can get an answer, how provinces who are leaders in research and veterans, like Halifax, for example, how they fit into that Center of Excellence. What is the communication? How can we identify to make sure that the best practices they may have or that may come up nationally can be shared so that we're able to, through OSI or other programs, support our veterans? The second one would be, as you noted, to see an increase of requests, 32% increase of people, and we know it's because we're doing a better job in awareness. But do we have those numbers as far as regional? And let's also look at Indigenous, like how many more of the 32% increase come from what province? Is it rural compared to urban, and is the Indigenous in there? And the final question would be, which is the 26.3 million investment for Canada Remembers program, and last post. What type of services do these organizations do for veterans? That would be my only question. I guess the other stuff you can send it in.
I'll begin with Center of Excellence and just say that the whole intention of it was, it has to be kind of, you have to hang your shingle out somewhere, and it'll be at the Royal Ottawa. But the whole idea of it is that this is shared information right across the country that will empower frontline medical professionals, and we have some 4,000 at our disposal. This will further information and research and development on PTSD and related mental health. And that will empower all the frontline staff that we use right across the country, and that communication will run 2 ways.
I'd like it to run 2 ways, where the expertise and and best practices in provinces.
And Mr. Sampson, I'm not territorial about this at all. I mean, that was the whole point of it. So it will be 2-way.
And I just want to reinforce what the minister indicated, and you'll be aware that the department runs 10 operational stress injury clinics coast to coast that are outpatient. And at the St. Anne's Hospital in Sainte-Anne-de-Bellevue, Montreal, we have a residential program there, and we fund veterans going into residential programs coast to coast. When we worked on the Center of Excellence, we went to our American friends who run their own medical system with 1,500 points of service, hospitals and clinics for their folks. And they've created centers of excellence across the country. What they found out, it is better to have a combination of a physical location and a virtual network in terms of a center of excellence. And so, for example, their PTSD Center of Excellence was in Vermont, but that wasn't enough. It was just one location for research, but they needed to network all of the best minds across the U.S. and internationally, because the challenge is upping the game of all the practitioners. So in our country, as I mentioned, we run 11 OSIs, both outpatient and residential. We're connected to 7 operational stress injury clinics run by the Canadian Armed Forces, and we are partnering with all of the provinces from Nova Scotia to British Columbia.
And Newfoundland.
And Newfoundland, sorry.
And I'm sorry, we're over time here now, so.
And we're trying to up the game of 4,000 mental health practitioners.
Thank you, and that ends the time for this panel. We have another panel waiting, so on behalf of the committee, I'd like to thank both of you.
Thank you all very much.
Testifying and for all you're doing to help. I know there's some questions that weren't answered, and I'm sure your department will get them back to the committee, and we'll break for a minute. Thank you.
I don't think you ended that.
Commemorations, Bernard Butler, Assistant Deputy Minister, Strategic Policy and Commemoration, Michael Doran, Assistant Deputy Minister, Service Delivery, and Elizabeth Stewart, Assistant Deputy Director, Chief Financial Officer, and Corporate Services. So we'll start with questioning, and we have Ms. Wagenthal up first.
Well, again, good to see you. Thanks for being here. I'd like to talk about the monthly pension side of things and just get a little bit clarity there. The maximum lump sum amount is $360,000 with a monthly payment of $1,150, and that's for the max. And nothing else has changed as far as determining what used to be just the lump sum amount. It's tax-free, and determining the degree of disability hasn't changed. However, under the monthly pension act, under the Pension Act previously, with exactly the same objectives and everything, the amount was $2,793 for a single individual without children, and here we're looking at $1,150. What's the rationale for that?
So thank you, Madam, for the question, for sure. So under the Pension for Life framework, there are basically three elements to be considered in it. So the first part of it is converting the disability lump sum award to a monthly pain and suffering compensation award. That's the $1,150 that you're referring to. The second element of it is, again, a non-taxable benefit, the additional pain and suffering compensation award, which will be paid to the more seriously disabled veterans who are experiencing permanent and severe impairments that are creating barriers to reestablishment. That benefit will be paid according to the degree of impairment at 3 grade levels, 500, 1,000, and 1,500. And then in addition to those two pain and suffering compensation non-taxable elements, there will be a third element, and that's the new income replacement benefit element, which is 90% of pre-release salary adjusted and so on. So it's very important when we look at the Pension for Life proposal to consider it as three elements. It's the sum of the whole. It's not a single element that is to be considered.
Okay, and so the $3.6 billion that's been announced is not actually in line with the amount that's actually being paid out, and I think that's where there was some questioning with the minister as well, because the amount presented at $3.6 billion is on an accrual basis, but when you look at the cash basis, it shows that the actual expenditure is the lesser amount over several years. Instead of a lump sum, it'll actually save the government over $1 billion in 6 years, when you look at the cash amount for this payment versus what's presented in the budget is an accrual amount of $3.6 billion.
I can address that.
Okay.
I would start, thank you very much for your question, by stating that the Pension for Life has not yet received approval. I acknowledge it was announced in the budget. It's not part of the main estimates, but I can provide an explanation of the investment calculation should you wish.
Okay.
So the $3.6 billion investment in Pension for Life announced in the 2018 budget is not in line with the amounts to be actually paid out in the upcoming fiscal years. And as another individual alluded to, the difference is explained in a note in the budget plan.
Right.
The amount of 3.6 over 6 years is presented on an accrual basis. And the accrual basis, essentially every year Veterans Affairs Canada reassesses the client base, and we work very closely with the costings with the Office of the Chief Actuary to look out 60 years and compare what the current client base has in terms of the status quo versus the new policy.
Can I just ask then, on that basis, because you went to the year 2022, 2023.
Yes.
Whereas if you went further, the amount announced would be lower than the $3.6 billion.
That's because the investments do not in any way mean that the Government of Canada will have spent $4.2 billion on the table in the budget letter in 2017-2018. The initial investment that is booked in the accrual accounting represents the additional investment of all currently eligible veterans. Every single one of them immediately received the entire amount payable by the government until death. Over the subsequent fiscal years in the accrual tables, the amount is negative, meaning that it will cost less than what was already payable as a disability award. If the government had presented the fiscal years after 22-23, the total investment would have been lower than the $3.6 billion announced. I would be pleased to provide a written comparison of the accrual accounting amounts versus the cash amounts that are actually paid and received by veterans in a fiscal year.
I think this is something that upsets veterans when they hear these numbers, correct?
Yes,
because
it's
when we
complex.
make these big announcements about the billions that we're spending, but then you look at the actuals, they're very different numbers. And I think that's where a lot of times our veterans are feeling very misled by the amounts of money that it appears that it's being spent on their programs.
I can understand
Yes,
that.
yes,
And
I'm just
we
that's
do-
a statement.
We
Okay.
do a careful walk between the accrual numbers and the cash numbers, and we can provide some background information to clarify that as well.
Also, with the new additional pain and suffering compensation that is available April 1st, 2019, so that's not in budget right now. And unlike the career impact allowance, it will be tax-free. But when you look at the numbers, the purpose of this benefit for disabled veterans, it has 3 grades and it's tax-free, but the amounts being given are less than the old program. So I'm assuming that the lower amounts are because it's tax-free, so they're not having to pay the taxes. So really, it's not a new program. It's the same amount of money, less having to pay the taxes. Would that be accurate?
Look, thank you, Madam, for the question. No, I think how I would frame it for you to better understand it is that under the old career impact allowance, it had received a fair amount of criticism from stakeholders, from the ombudsman over a number of years when it was originally framed as the permanent impairment allowance. And the issue was that the policy rationale was related to trying to ensure that we were addressing issues around impact on careers associated with severe disability. So this new program, the additional pain and suffering compensation, you're absolutely right. A big portion of it is that it is tax-free. So it's actually approximating what was the CIA under those grade levels. The other thing that's very important is that the career progression factor has now been actually built into the income replacement benefit, so that veterans are actually going to benefit on both sides of the equation, the non-taxable APSC and the taxable IRB income replacement benefit.
Thank you. Mr. Sampson, 6 minutes.
Thank you, all of you, for being here today, and always nice to see you here and getting more specific information concerning some of the issues that we're hearing. I will continue on my flow of access to doctors who can assess veterans who are in need of medical cannabis in Nova Scotia. I still do not have a list of names that are, and what we have to do. I think there's another list that came the other day, but we've been going through that, and our people don't have access. I don't know, maybe Mr. Duada, I know you've been working on it, but I still have my issues, and as long as I have my issues, you will have my issue with you.
Thank you, Mr. Chair, for the question. And Mr. Sampson, I know as long as you have that issue, I will have the issue. I'm aware. We've chatted about it. I'll follow up because I thought we had sent a list to your office. There is, I just wanted, on marijuana, I'll restate what I think I've probably stated often at this table, but the responsibility of, I hate using the term given a prescription, but you do not give a prescription for marijuana. It's not it's a script, resides with the medical doctor. Veterans Affairs, in this case, we are actually the payer. And I won't say only the payer because we do an oversight and we work, but we're the payer. If it's over 3 grams, they do have to see a specialist. And we all know there is challenges across the country, as you heard the minister and the deputy minister talk about getting doctors in certain areas of the country. And even more so if you need a psychiatrist, you know, because you need something because of mental health and you want a psychiatrist to prescribe. We've had the conversations about Saskatchewans multiple times. It's not always easy. So there is a list of people out there that will help veterans to get that script, to get it. So I'll just make sure your office have received that. So, and there are a couple in Nova Scotia, so I'm a little, so.
Yeah, well, as you know, we've been having a lot of trouble with that, and it's not right if other provinces or individuals have access and we don't, which is crucial. I have to say, the Atlantic Desk, we have Christian, I think, that's there now, and he's doing a good job, so I want to share that. I think that he's drilling deep for us and trying to find answers, and that's very important for any MP. It doesn't matter who you are. It's extremely important that these individuals want to find the right answers, and they do so. I'm still hearing that, of course, delays. There's still delays. It's, you know, so how are we doing? Like, I know you came last time and said that there was improvement and whatnot, but I know there's a lot more demands. The minister shared that as well, I think 32%. But are we getting there? And if not, what's the plan? And if so, what's making it different?
Thank you for the question. I knew this one was coming. We're not making progress to the level I would like. I'll say that right up front at the table. Our incoming is exceeding anything we've ever seen, which is, as the minister said, good news, but it is my challenge to try to fix that. And I will admit it is daunting. Our pending, that does not mean files that are late, by the way. That's the work in progress WIP, depending where you've worked. People use different terms. We call it pending, is now around 33,000. And with that is the new files from, the new program, from April 1st that have come in. Our backlog is just above 10,000. So we've undertaken multiple amendments to fix it. We have or will be staffing up once we get all the authorities. But as the deputy minister said, or the minister, I forget which one, we've actually gone out now and are doing pools. So when I get the money, I hit the button, the people get into the seat. Sorry, I usually use another term, but they get into the seat. But the reality is we have to get to the fundamental basis of why there's a backlog. And numbers is one thing.
I don't want you to take too much.
Okay,
because
sorry.
They'll ask the question, right?
Okay, so we're working on
and you
various...
can expand on that answer. I guess...
Various avenues to accelerate it.
Yeah, okay, thank you. And I know you'll get those questions. I don't mean to cut you off. I apologize. I guess I want to touch the last one is important, is the pension for life. Now, we still are trying to drill and get a good comprehension of that. But if you already received your lump sum, which would also have included your increase in lump sum on April 1st of the additional 50,000 pending on your percentage. Can you still get on that track, and how do you get on, and how does it reflect, how does it work to some extent? Just taking a basic formula. I don't want, because there's all kinds of category of pain and suffering, additional pain and suffering, 90%. I don't want that, but just basically, if you got your 100% lump sum, are you still able to get on, and what does it, how do you track on?
Okay, so thank you for the question. So, Mr. Chair, essentially what we're doing is, because of the fact that the recurring monthly pension or pain and suffering compensation may in fact be worth more to you than the lump sum was, depending on your age and when you received your lump sum award. So essentially what we will be doing is, come April 1st, 2019, every recipient of a disability award, every recipient's file will be looked at, and there will be a simple calculation made to determine whether or not, had that veteran received the lifelong benefit, the monthly benefit, back in time when they received the disability award, there'll be a calculation done to determine whether or not that recurring monthly benefit is worth more. And if it is worth more, then there is a formula considering the age and gender, actuarial analysis, and so on. There'll be a simple formula that will determine on a go-forward basis what the difference would be. And they'll receive that amount for life.
Thank you.
So that's in a very simple explanation.
Okay, thanks. Appreciate it.
Thank you.
Super. First question is, we talked about the inpatient care facilities, and the minister clarified that there's no intention of creating inpatient care facilities. Just a quick question, has the department ever sourced out what it would cost or done any research and developed any plans around? So nothing's been planned, even though the government made these promises to veterans in 2015 during the campaign. There's been no cost analysis or no plan on doing this. So there's no report to the minister that's been.
Not on, and except the cost of the St. Anne's Hospital, that is an inpatient facility.
Okay. Education benefit and training program is the last time you were here, you said it was at $22 million. Has that number changed?
No, it hasn't changed.
So it's $22 million still?
Yes, and the issue is that we have a system of internal controls where we assess on a constant basis the intake and the projected intake and adjust as may be required.
Okay, great. Yeah, because the promise was $80 million. Now it's $22 million a year. So again, just it's quite a significant reduction in what was promised. So in terms of that, it'd be great to get some information about the numbers that are getting rejected as well. If we could get that table, that would be fantastic.
May I?
Yep.
The education and training benefit is $133.9 million over 6 years.
Yeah, it's $22 million a year.
Right, to provide up to 80,000 to veterans in support of post-secondary. Thank you.
That's great. So back to the website, I talked about this earlier, that Veterans Affairs Canada, it states right in the website, is having difficulty providing timely, high-quality core services and benefits to veterans and their families, while simultaneously implementing several new initiatives and programs from multiple budgets. And I know, Mr. Dorion, you identified that the backlog's not getting better. I mean, it increased 50% from last year, February to November. To 29,000. Now you're saying it's at 33,000.
Sorry, I'd like to clarify. That's not the backlog. That is the pending.
Okay, that's pending, and the backlog's grown from 9,000 to 10,000 in terms of
correct
over your terms of your conditions, your targets that you've set for delivery. So, I mean, I think there's something to be said about that people are finding out about the programs, but also you're creating more programs that you're offering veterans. So these programs are no good to anyone unless they can access them. So this is a problem, and I think I've asked this before, how the department's come up with $42.8 million over 2 years. Has there been an analysis of how we get this backlog to zero?
Yes, so thank you for the question. There has been analysis. To be honest, I don't think we'll ever get the backlog to zero, because in an operational environment, you always have files that for good reasons will be late. So I just want to say...
How do we get it away from growing?
But how do I get it away from growing? I said, at the moment, I'm treading water. So from a week to week, I'm staying at about the same number.
So you're not properly resourced. That's clear. I mean, the government on the political side is making announcements. They're making commitments. They're not properly resourcing you and the department. And then veterans are being given these false promises. And we know what happens when veterans are promised something, they don't get it. They fall through the cracks. They get disappointed. So, this is where we're trying to help you, actually. And, that this is what we're facing here. And I just, we want to know what the plan is. What do you need? What does the department need so that veterans aren't falling through the cracks and that the government can start following through with core service delivery instead of making more promises?
So you will understand if I do not comment on the political side of the question. I mean, I as a bureaucrat, I'll stay away from that part. Mm-hmm. But you are correct in the sense that we have to get these files out faster. On the case management side, in the field, we're not at 25-1, but at a national level, we are running at approximately 33. Mm-hmm. And with the additional money, this will bring us, if not to 25, it will bring us below the 30-1 into a comfortable zone.
If we're at staffing levels back to 2012, would we be at 25-1?
No, we would not.
Okay, so we need more than that. So we're so far off the mark in terms of resourcing the department with the adequate amount of staff to meet veterans' needs for the core service delivery, never mind all of these new programs that have been announced. Would that be accurate?
I think with the addition of the 460 and the addition of the new funds, we're going to be close. But I think what we have to do is add automation, and that is something we're now working with the government
I appreciate
to bring in the automation, because we can't continue doing the stuff the same way with these numbers. So now we have to maximize the use of artificial intelligence, better systems. We've done with the new programs, but we have to
think
get it
we
to the
agree
old
on
ones.
the innovation, and it's a way to go too, but we also need to make sure you're adequately resourced. And it's the same argument about service delivery for PTSD. Innovation isn't going to do it alone. Veterans are asking for inpatient care facilities specific to their needs, and they will travel from Halifax to Saskatoon if a facility's there. They're asking for this, wherever it is, you know. They're willing to travel, but they need these facilities. This is something that was promised them. They need it. And I know that the minister has his argument about that it's going to be fine in the types of ways that you're going to outreach to veterans. They clearly, some of those veterans are falling through the cracks. They need facilities. So in terms of the caregiver recognition benefit, we're hearing lots of complaints and concerns that many of the caregivers they're getting rejected, especially those that their spouse is suffering from PTSD. Can you explain why that's happening?
Well, thank you for the question. I think I'll clarify. The numbers that we've received to date on the caregiver relief program, not a lot have been rejected. So I just want to be clear on that.
One last question, just on the. Okay.
Okay.
Sorry. Okay.
Mr. Yolfison. Or no, Mr. Pertina, sorry.
Thank you. Could we look at year to year? Because we keep hearing about the backlog, which has been increasing because there's more awareness and more programs. How many are we actually serving in terms of, what's that number?
So our numbers of clients are going up. The number of claims coming in for services are going up, and we have been doing the numbers year to year. As an example, just in first application, which is where the biggest part of the backlog is. So that is somebody that has never come to the department who's now showing up for help. We've seen from last year to this year a 22% increase, close to 23% increase in incoming first applications. That's not everything. If I add everything in the lump, the increase is 32% in the adjudication area. So we've done a lot of analysis and trying to get to where is the issue. So right now we're targeting first applications, because that's my biggest increase. 7% in the departmental reviews, various other numbers increases, but at 22%. And I do want to be clear, we've increased production by 25%.
Yeah.
But the reality is the incoming is outpacing production. So now we're into working with my colleagues in policy and in finance at is there other ways we can tackle this to make it easier for the veteran, simplify the process to accelerate the process. But there's some systemic issues related to this, and when you talk backlog, as an example, it takes us on average, it takes close to 3 months, I'll be careful on the days, but close to 3 months to receive files from the Canadian Armed Forces sometimes. And that's 25% of my workload. Well, if I have 4 months to process a file, and the medical records, because they have to go to bases, and I'm not faulting my colleagues, my partners, they actually have to go get the file on the bases and get it to us. Well, that means I now have 1 month to process. So a 4-month process to process this, to make sure we have all the information, falls to 1 month. So we're looking at ways with the Canadian Armed Forces, can we accelerate the electronic file, the medical file? Is there things we can stop asking to actually accelerate it? So if I don't need the file, let's not ask for the file, which I just saved 3 months. So that's what I mean when I talk about we have to get beyond just asking for resources. The government, I'm a public servant, and I'm here to serve the government, all governments, and the Canadians. At the end of the day, that's what I do. I serve Canadians. So, okay, we have money, we have amounts. How do I now get to meeting program obligations within what the government of Canada has decided to give us? And that is now looking at removing the bureaucratic barriers, the 40-page forms that doctors don't like to fill out. And there are some, there are forms that are, so, the psych form went from 16 pages down to 6. Now you would say it's still too much, and my deputy is challenging me to get to 1, but we actually need a diagnosis and we need information, because it is a disability program. So, it's not you just show up and we're going to give you money. There are criterias in the law, and this committee is very well versed on that because you've worked on that. So we are working at the other matters, not just adding people. Adding people, yes, and to your point, it's important, but how do we get to the processes and eliminate and become way more lean, and not necessarily the lean methodology, but more lean in our processes.
Right. Going back to my municipal days when we get an agency budget, the most fascinating line was always other. And so in transfer payments to persons, you have other, 29,406,000. Just curious, like what would be the other uses or the expenditures on that file, on that line item?
I'm sorry, what page are you on, please?
Well, you have transfers to persons, pensions and benefits, disability awards, Veterans Independence Program, earnings loss benefit, and other transfers to persons.
Oh, there is a plethora of transfers, grants and contributions to persons. I have an entire list. I would be happy to provide it.
Okay.
Okay.
Just
Yep.
for curiosity.
Absolutely. My pleasure.
And
Thank you.
on personnel costs, 236,623,904. Is that, how many personnel is that divided by?
Well, there's the different ways to measure personnel.
Okay.
PSPC has full-time equivalents. Then we have the salary wage envelope. But to answer your question in short, we have approximately 2,750 full-time equivalents in the department, representing that amount of salary that's been approved. And I would add that salary accounts for 76% of our entire operating budget.
What would that, on a year-to-year, last year, 5 years, can you give me a sense of how that's growing?
Okay. Well, with approved Treasury Board submissions, we have had increases in staff, most notably in the front lines, as we've been discussing. I think the important thing to note in Veterans Affairs Canada is that just under 94% of the entire allocation is spent on benefits and services that go directly to veterans and their families. The remainder is the operating budget, and included in that is a special purpose allotment called Other Health Purchase Services, and that pays for a number of things such as dental implants, all kinds of things, treatments for veterans. And then there's the small portion that is about $270 million baseline, which is 76% of that is personnel, and the remainder is operating.
Okay.
Olson, 6 minutes.
Thank you.
Okay. All right, thank you, Mr. Chair. Thank you all for coming again. Now, from what I understand, and again, there may be some repetition given how many questions have been asked over the last couple of hours. But I guess there's an anticipation from Veterans Affairs that approximately 500 people will receive the caregiver recognition benefit for 2018-19, and a total expenditure of approximately $6.5 million. Is it anticipated that the number of people receiving this benefit will remain stable? Or is there any expectation whether this will increase or decrease?
Thank you for the question. We believe it's going to be pretty stable. There's always some fluctuation, but it will remain relatively stable.
Okay, thank you. And this $1,000 per month for the caregivers, is this indexed, or is this is it like indexed to the
CPI.
income of the caregiver?
Go ahead. Yep. It is indexed to CPI.
CPI? All right, thank you. Now, in regards to level of impairment, when caregiver is caring for a veteran, does this have to be a total and/or permanent incapacitation, or can there be various levels of disability of the veteran that the caregiver will receive this benefit?
Yes. So I'll be technical a little bit on this one.
Sure.
Good.
So when
We like that.
Yeah. So when we do the caregiver benefit, the veteran, the instrument we use is the instrument of activities of daily living. So can the veteran wash? Can the veteran dress? So we're talking about our critically injured veterans. So if they have a hard time dressing, if they have a hard time brushing their teeth, there's examples used. That is it's more complex than that, but that is part of the criteria to determine if a veteran is eligible for the caregiver relief benefit. So So that's the item that we use to determine, and it's on their website if you want to see all the stuff. It's actually very well indicated. That is the basis of determination. The activities of daily living.
Okay, thank you.
May I make a correction?
Please. Yes.
You asked the question about the caregiver recognition benefit.
Yeah.
It's a tax-free benefit of $1,000 a month directly to the caregiver that is indexed annually to keep pace with inflation. My apologies.
For inflation.
Not consumer price index.
Okay, thank you. Thank you. All right.
Which one is better today? I'm not sure.
Yeah. All right. Thank you. So, when we did our study in transition, we heard some importance of peer support, and a lot of veterans had positive experiences with the OS, ISS. And are you able to expand on any other initiatives that will be supported through Veterans Affairs?
Question. Yeah, we're working very closely with the Canadian Armed Forces, which I believe General Meisner was here presenting on some of the initiatives, and my team is working hand in hand with them to add more people right on the front line, IPSCs, JPSUs, or whatever the new terminology may be when they're all finished, the review, but to actually help people during transition to be actually in the trenches with our colleagues at Canadian Armed Forces. And actually, because of a report from this committee, we now have authorities to work, I call it upstream, because before we could only start working with a veteran when they became a veteran. Now we can actually start working with them when they're in. The other thing is the family. I mean, there is a whole series of, and I won't get into those details, but a series of programs like the military family centers where we've added resources which will help in transition. The career transition program that now people are taking. They're all things to help, and additional programs help them. But we're really focusing now, and we're now talking to government about these new programs, working hand in hand with the Canadian Armed Forces during transition to make sure that there's no duplication, that we work closely together, but that we try to address the people falling through the cracks.
All right. Thank you very much.
We'll have an awkward pause, and we'll go to Mr. Kitchen for 6 minutes.
Hopefully, some of these questions will be able to be fairly quick, as I've got a number of tasks. Can you tell us how many caregivers under the old benefit haven't yet applied for the new caregiver benefit?
That have not applied? Well, actually, it's automatic. They're in, but we have. There was 362 under the old benefit on March 31st. To be exact, and right now 244 has automatically transitioned, and the other ones we're now reaching out. Why have they not provided us the information? Because they're eligible.
Sure. How many that had previously funded no longer qualify for the new caregiver benefit?
There may be 26, to my knowledge.
26, okay. And when we were traveling, this past week, we heard from a veteran who had said that she had 2 claims pending, and she was told her requests are being held until April 2019 because she will receive more money once it's processed after April 19. So how much of their current backlog is due to this decision to the delay, and how will this impact current budget?
There should be none of the backlog related to what you told me. So if you wouldn't mind giving me the name of that person, I'll follow up, because it sounds to be something very specific. If they're applying for an injury or any one of our programs that are in existing today, they should not be told to wait in 2015 now. Somebody may be counseling them saying there may be more benefits under the new, but it should not be. Sometimes some of those recommendations do not come from Veteran Affairs staff, so we do have to be careful. But if you have more information, I'm willing to take it offline.
Sure, thank you. Now I'm going to go to some of the numbers, and I'd asked the minister earlier when he talked about basically about the Center of Excellence, and there was a huge announcement about $17.5 million over 4 years for the Center of Excellence. And I'm just asking for you to clarify, because within the budget and within the numbers, it basically is saying only $500,000. Can you explain that to me? I'm not an accountant. I don't follow. I have a basic understanding of line items, but
Okay, so this year is setting up the center. So the needs of the center and the obligations of the center, we estimate will be in the realm of 500,000. Therefore, why the line object this year is 500,000. So that means helping the Royal set up the board of directors and, you know, putting the right mechanisms in place, et cetera, et cetera. Subsequent years, so next year, we're going to bring in, or I say we, it's not me, okay, it's the center. We'll be bringing in the staff, giving out the research grants, you know, all the management. So that's where the money then goes up. So the first 4 years really the setup, and then it's an ongoing amount. So that's why the first year is really a little bit more select.
And may I add that the
3 minutes? Okay.
there will be 9.2 million ongoing.
Pardon me?
There's $9.2 million for ongoing expenses.
To this budget or for future?
Budget 2017, an investment of 17.5 million over 4 years, starting in 18-19, and 9.2 million per year ongoing.
Okay. Thank you. Can you point out to me where in the budget about because the minister's talked to us about advertising, especially to rural Canada and to rural parts, where those figures are within and how much that would be?
There's two aspects.
Okay.
The main issue that has to do with advertising is there's an annual submission that goes in that is centrally managed, and the advertising amounts are included for the federal government. Each department has an amount, and we report on expenditures as well. But more specifically, not quite advertising, but the outreach. I think it was mentioned earlier. Budget 2017 was 22.4 million over 3 years, starting in 17-18, in an outreach strategy to ensure that veterans and families are informed of the range of supports available to them.
So you've got $22 million basically to put forward for advertising.
For outreach.
Outreach. Okay.
Outreach. So
my next question to you then is why? And I hate to throw you under the bus, Mr. Dorian, but why you would be sending out to newspapers in rural Canada and asking them to publish as a letter to the editor instead of advertising about services that you provide for our veterans in rural Canada. I'm happy to give you the copy of this once you're done.
Can I send that out? I'd like to see it because I don't remember sending that out. So it could have been something, maybe my colleague ADM has more information on it.
Yes.
Because these rural papers are your supporters. They're there to help you. But you've got a budget, and yet you're not utilizing them to provide this service for you. You're asking them to do it for free, and they can't sustain it because these people don't, in rural care areas, have the technology for Twitter, et cetera. They don't have the lines.
I take note of your comments and we'll take it back. But I just want to point out that we have been working on an outreach strategy. And again, there's advertising part of it, but also using social media and also working with our local partners and folks on the ground to get the word out to the organization that helps veterans and reaching out to veterans. So the strategy is not just focused on advertising or relying on what would local media available, but it's a much more extensive, exhaustive strategy.
For sure.
30 seconds.
Okay, thank you. Finance Department officials have calculated what a carbon tax is going to cost the average Canadian family. They've not shared that information with Parliament. In fact, it's been redacted. My question to you is, have you been involved with any discussions with Finance Department to understand the impact that a carbon tax is going to have on veterans and their families? And if so, do you know what that number is?
To the very best of my knowledge, no.
Okay, thank you.
Ms. Lambropoulos and Mr. Fraser, I think you're splitting, but wait.
I think I'll go. Yep, thanks, Mr. Chair. Thank you all very much for being here. I wanted to ask, first of all, I asked a question to Minister O'Regan regarding the $1 million Veterans Emergency Fund. And I know that's part of these estimates. I'm wondering if you can explain to me exactly how you envision the fund working and who would make the decision of when that money can be utilized to help a veteran in crisis.
Thank you very much for the question. So this is probably the one that I'm believe it or not, the most excited about. Because that is the area where I always felt that we were not, we didn't have the penetration that we should have. And I've had to go in front of media and everything else the last couple of years to say, we have 23 funds, one may be depleted, but, we're trying to work this, what the minister described. So on this one, $1 million a year, I think will go a long way to helping our homeless or maybe not so homeless sometimes, but people couch surfing or, they're not all on the street when we say homeless, right? So it is determined by our field operation people. So there is an app, you can use the thing, or you can walk into one of our offices. After hours, we set up a whole system, our 1-800 line that we have associated with Health Canada, where, a veteran can call 24 hours a day, 7 days a week to get services. Now, as part of that call, if that call comes in that somebody has an emergency, they need, whatever, whether it is at 3 o'clock in the morning or a Sunday, the Health Canada people have been trained, and they now will refer the call. We have people we have people at the end of another phone, but it's seamless for the veteran. By the way, the call is transferred to a frontline worker to say, what is your emergency? Now, I'm pleased to report we've had none of those calls after hours or on the weekend. So we're going to reassess after 6 months if that's working. But the local office, the case manager, or the veteran service agent will make the determination of, is this a genuine emergency or not? And I'll be honest, we've had people that have tested the system in the 3 months. I want to get my roof fixed. Well, if you're on ELB at 90% and you're bringing in a fair amount of money, your roof may be broken, but it doesn't necessarily mean it's an emergency. It may be an emergency for you. I live on the coast, so every once in a while the wind rips a couple of shingles off of my house, but it doesn't mean that it's an emergency. Now, I can't pay my electrical bill and I'm going to be expropriated on a Friday night. That's an emergency. What can we do to make sure you don't land on the street? So the frontline staffs are doing that. We've worked with our finance colleagues to have a way to pay immediately. And we're also working with the plethora of associations out there that work in the realm of homelessness and people at risk, to be able to get these people in, whether it is a shelter or a hotel room or get them a meal or whatever. So it's only been 3 months. Yeah. We're still learning. We may have to tweak some stuff. I'll be honest, these types of programs, you always, because as of now, we've received 183 requests for the Veteran Emergency Fund. 100 was favorable.
Yeah. And when you say you receive requests, I assume that if a case manager is dealing with a situation and sees an opportunity to use the emergency fund, then the person doesn't have to ask for it.
They don't have to ask for it. The case manager or the VS, we call them VSA, the Veteran Service Agent, can say, you know what, we need to go there. Before they used to go to these bequest funds. Yeah. Now they have a fund they can go. And often what it allows us is put somebody in the hotel room while we determine what is your actual eligibility for our other programs. Is there a service-related injury or not?
So-
That's why this one I think is real.
Those bequest funds are still there and available.
Absolutely.
This is just offers some flexibility to Veterans
Absolutely.
Affairs to deal with cases that may take too long to go through that method. Okay.
Sometimes the bequest funds are not able to be used because they have very specific conditions
Right.
for their application.
Okay. Thanks. I want to turn to the caregiver recognition benefit. And I know this is a very important measure that will help a lot of veterans and their families, so spouses taking care of veterans, $1,000 a month tax-free. Do you see that amount being, or the number of people receiving that benefit being pretty stable over time, or do you think it will be increasing or decreasing? And if so, what would be the reason for that?
I mean, it's hard to predict. I suspect it's going to go up, but don't ask me to what extent. I can't. I just think once it gets better known and the program is out there, I think we'll see a bit of a bump up. I don't think it'll be a huge bump up as long as there's no changes to the program, as long as the program remains as it is. And I think it's just a better awareness. I think as people get more aware.
Mm-hmm. And what's the uptake so far?
Up to now, I have had 271 applications, and as I mentioned earlier, you know, we're waiting for all the 362 that were on the previous program to come in, so we're outreaching those individuals. So, you know, 244 was from the old program, so you're talking probably another 25 new people have applied.
And I
approximately.
know the minister talked earlier about being proactive in ensuring veterans and their families are aware of the services and
Yes.
benefits provided to them. What about the caregiver recognition benefit? What's the department doing to make sure people who could qualify are aware that it's there?
So notwithstanding all the outreach and communication we've done on the program, all the veterans that were on the program, it used to be the Family Caregiver Relief, we send them out some correspondence and said, contact us. And right now, because there's outlayers and we're trying to figure out who are the outlayers, we're looking at actually contacting them by phone.
That would be
Okay,
great.
great.
Thanks.
Thank you. That ends our time for committee questions. We have a vote here now. Pursuant to Standing Order 81-4, the committee will now dispose of the main estimates for the fiscal year ending March 31st, 2019, minus the interim estimates of the House agreed to on March 22nd, 2018. For the Department of Veterans Affairs, votes 1 and 5 for the Veterans Review and Appeal Board, vote 1. Do I have unanimous consent to vote it all in one motion? On division, okay. So we'll start with individual votes. Shall vote 1 under the Department of Veterans Affairs for, that's a large number, 777-033-427, Carrie. I believe that's in the millions. Can I see hands, please? Carried. Shall vote 5 under the Department of Veterans Affairs for 2495267 Carry. All in favor? Carried. Shall vote 1 under the Veterans Review and Appeal Board for 7188115 Carry. All in favor? Carried. Shall I report the votes to the House? All in favor? Carried. On behalf of the committee, I would like to thank all of you for appearing today and taking time out of your day and for all the work that you do to veterans. I know there were some questions that were asked that you might get back to our clerk, and I appreciate all the work that you do. Motion to adjourn. Mr. Sampson, all in favor? Carried. Thank you.